How are you doing? I welcome you back to my YouTube channel. This is JEMIENAFTALY and the channel's name is called The Pediatric World. And here the channel is all about the kids' welfare, the medical problems affecting these children, and also the solutions. So we try to look for solutions here, and we are talking to everybody because we are talking to that mother, we are talking to that caregiver, and everybody on the illnesses that children get while growing up. So I welcome you to this YouTube channel. So if you're new, welcome to the family, and also follow the previous episodes, and also don't forget to subscribe. So I welcome you all to this episode. So today's topic is about diarrhea and vomiting in children, another killer disease. Remember, we were talking about pneumonias, and we said again pneumonia is a killer disease. So diarrhea and vomiting is also a killer disease in children, the under 5s especially. So it is very, very important, and we are going to see why. This is because this diarrhea and vomiting will lead into something we call dehydration. Dehydration is whereby most of the fluid, the body fluid, is no longer there. We get rid of this body fluid through diarrhea and vomiting. So we end up having dehydration. And when there is severe dehydration, the babies present with something we call hypovolemic shock. Imagine, it is that serious. So most people may underlook this diarrhea and vomiting, but we are going to see that it is a killer and it is very, very serious. So then, by definition, what is diarrhea? When do we say this is diarrhea? Diarrhea is passage of loose stool or watery stool, and this is for more than at least 3 times in 24 hours. So this diarrhea has to be watery, or it has to be loose, and then it has to be at least 3 times in 24 hours, 3 times in a day. So this is what we term as diarrhea. Having said what diarrhea is, we have 2 clinical types of diarrhea. We have 2 clinical types of diarrhea. Number 1, we have something we call acute watery diarrhea, the one we have just said, passage of loose or watery diarrhea, watery stool for more than 3 times in a day. The other clinical type of diarrhea, we have something we call acute bloody diarrhea. So here we have blood, and it is again for 3 times or more, but here we have blood. So here the management is going to change from that of watery to this bloody diarrhea. So those are the 2 clinical types of diarrhea that we have. What are the causes? The causes of diarrhea, or the risk factors to diarrhea, risk factors to getting this diarrhea. So number 1, we have something we call biological and behavioral factors. So we have something we call malnutrition. Malnutrition is when children are underweight. According to their age, they are underweight, and these children are going to be associated with increased severity of this diarrhea. So diarrhea is worse. It is worse in these children with malnutrition. And also in malnutrition, this diarrhea is going to have a longer duration. So it is going to take longer. So malnutrition, we are saying, is a risk factor to diarrhea. That is number 1. Another risk factor, or the cause or the risk factor, is the age. So the age is very, very, it determines diarrhea. So because the smaller children, their diarrhea is going to be more severe than the older children. Why? Because of something we call body surface area. So the age is a risk factor. We have something we call immunization. So immunization here, we mean, what do we mean by immunization? The commonest, we are going to see, but let me mention it here, that the commonest causative agent of diarrhea is viral, and it's a virus we call rotavirus. And so the children that are immunized against this rotavirus are not going to be weighed down by this diarrhea compared to those who are not vaccinated against this rota. This rota, which is, we are saying it is the one that is causing diarrhea. Remember in our episode on the immunization in children, we said rota vaccine was added by the expanded program of immunization. It was added, and this is because of the diarrhea, the increased cases of diarrhea. So if you haven't, again, revisit the episode on immunization. So we are saying rotavirus is the most causative microorganism that causes diarrhea. So those children, immunization, if those children that are immunized against this rotavirus are safe, compared to those that are not immunized. So that is a risk factor. We have something else we call, another risk factor is the immunocompromised children. What do I mean by immunocompromised children here? So we remember we say the meaning of being immunocompromised is when the immunity is low. It is low, and it is low in children with, for example, those children with HIV, the children infected with HIV, also children with cancers. So if they have these pre-existing conditions, then their diarrhea is going to be more severe. It is going to be more worse. So immunosuppression is a risk factor. So remember that. Also, we have another risk factor, that is feeding practices. So here I'm going to mention that feeding bottles, you know, the feeding bottles with where babies sip from, where you put water, you put milk. So these are the feeding bottles, and they increase the risk factor of diarrhea. It is very, very interesting because people are going to ask then, what are they going to use to feed their babies? So imagine that the cup and spoon feeding is more safe. It is more safe when you use it in children than the feeding bottle. The feeding bottle are at high risk because it is going to drop many times, and if it is not again going to be cleaned well at the nipple, at the end, so the babies just sip from there, and this introduces the microorganism. So feeding bottles, and this is what we are calling the feeding practices. This is a risk factor. You did know that, but now you know. Another risk factor is poor hand washing. When you're handling the food and the everything for the kids, the hand washing is key. The hygiene is key here, because we don't want these babies to you contaminate their food. So we need to do the thorough hand washing. Wash your hands well in running water using soap and water before handling their food. They are going to be very sensitive if we don't do the hand washing. Another risk factor is those children that are not breastfed well. So if you didn't exclusive breastfeed your child well for the first 6 months, remember when we were talking about breastfeeding, we said we should breastfeed our babies exclusively, meaning nothing else, even water, until when these babies reach 6 months. And from there we should do it beyond, up to when the babies are 2 years old. So if you haven't again watched on the breastfeeding, please do, so that you understand these things. So if the babies are not breastfed exclusively, these babies are the ones that are going to present with the diarrhea. And why? This is because remember we said in the breast milk we have things we call immunological factors. This is where the babies get that from. So if your baby was not breastfed well, then they are not going to benefit from this. They are not going to get these infections more easily if you did breastfeed your baby well. And we said it is 10 to 15 minutes in one breast, so that the babies will have reached those immunological factors that prevent them from getting these kind of things, these diarrheas. So exclusive breastfeeding, this one it is for sure going to prevent these diarrheas. Also, when we are there on feeding, the early weaning is introduction of other food, introduction of the complementary food. So early weaning, so again we are saying we should wait until these babies are 6 months so that we start giving other foods. Again, we are going to prevent diarrhea here. Other causes, we have environmental factors. We have seasonal variations. We have poor domestic and environmental sanitations. Again, this is unsafe water. So the baby should get boiled water. So safe water is key here. So that this is what we mean by the environmental sanitation. Another way is the poverty also. It is in that line of the risk factors to dehydration. This is because maybe when I say poverty, we have the low economic, the low socio-economic status of different families. There are those that are not going to avoid the food, the strong food that are really strong to prevent this diarrhea when the babies are bigger. So poverty comes in here. So basically those are the positive the risk factors to diarrhea, and we are saying diarrhea in children is a killer. It is a killer, and we have said why. So please remember everything and don't forget that. So this is it, and it's going to also to be a wide one. We want to move slowly so that people can really understand. So thank you for staying with me. If you haven't subscribed yet, please hit on the subscription button, subscribe, like, share these videos so that many people can reach them. Also, leave a comment below on the comment section. If you have any question, my email is somewhere at the end of the episode of the video. So if you have any questions, you can ask in that. You can use that email there, and also hit on the notification bell so that you are able to know whenever I post a new video. Thank you so much for listening to me. Till next time, bye bye.